My name is John McKeon, and I'm the moderator for the Teradata Primo River. Today we have with us Rick Andrews. He works for CMS, which are the centers that handle all the Medicare and Medicaid services. He works as a health insurance specialist, does a lot of analytics and BI, and he will be speaking at the Partners Conference coming up here about real stories from the heroes of analytics. Rick, you have a lot of data that you have to deal with, requests from Congress, requests from the White House, from the public, particularly with the healthcare bills coming up. Tell me, how do you deal with all these different variations of data and do it in a timely fashion?
We often have to come up with scenarios to create estimates on the future cost of healthcare, and we have to summarize billions of claim records in a timely fashion. And in our old paradigm, we have mainframe tape files that hold this data, and it could often take days, if not weeks, and sometimes even months to summarize those claim files. And fairly recently, we have started utilizing some of the newer technologies in the database systems, and now we can summarize those billions of claims in minutes and hours instead of days and weeks.
That's a huge paradigm shift. But what about when Congress comes in or somebody comes in and says, tell us about predictions for the future? What do you do in terms of actually trying to predict things like future healthcare costs?
Absolutely. What we would like to do when we're predicting the cost of healthcare is we want to identify a certain population. And if we can get a population that is the same from year to year, we can then make estimates based on assumptions. And it has typically been very difficult for us to identify the beneficiaries that meet certain conditions and then merge that data with all of the claim files. So that has been a huge advantage for us working with these new database systems. And we now have the ability to very quickly identify a population and go out and get all of their claims in order to make these assumptions.
Well, Rick, that's a really interesting job that you have dealing with all the ever-changing healthcare needs. What about the darker side? What about the issues of fraud? How does your new database environment help with fraud prediction?
Absolutely. There's been an awful large amount of interest now in identifying fraud. We here at CMS have been using these new database systems to seek out individuals who might not have fraud but could potentially be overutilizing or maybe misusing some of the codes. And in particular, we found some home health providers in Miami-Dade, Florida, that were utilizing more than 40% of the total for the nation. And there's been a number of stories written about it in the news, and quite a few providers actually were sent to jail. So some of these new database systems were instrumental in helping us seek out these fraudsters.
Rick, very interesting. So from a kind of a broader perspective, how will the performance characteristics of your new database environment help facilitate the change and evolution of healthcare itself?
Every year, especially with the latest bill that came out, a lot of questions came from Congress. For instance, they wanted to eliminate the Part D coverage gap. A lot of folks call it the donut hole. And so, when they were designing this new section of the bill, Congress would come back almost on a daily basis and ask us, what would happen? How much would it cost the taxpayers if we were to close the coverage gap all at once? And we would have to go out and summarize our data in a day's time. They couldn't wait for weeks or months. And then they would come back again and say, well, we don't want to close it all at once. What if we close it over a period of years? And they would come back and ask another question, like, if it were raining on Tuesday, but there's no clouds in the sky, how much would it cost us? And it was very easy for us to go out to this database and quickly summarize that data for them.
Rick Andrews, he is a health insurance specialist for CMS, Centers for Medicare and Medicaid. Should be a great session at Partners Conference. I suggest that you attend if you can. Rick, thank you very much.
Thank you.